Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your co-host, Nita Valens, and we're taking your calls at 866-870-5752. Dr. Darrow, would you like to talk to Barney?
I would, Barney and Carl. Hang with us, guys. I got a couple things to say. Our show is about how to heal your musculoskeletal pain. That's your orthopedic issues without surgery. I have been in this business a long time. I've been doing regenerative medicine for over 25 years, using platelets, using stem cells, and I find that most of the cases that come to me do not have surgery, even though they're told they need it. We hear every day people come, I've got bone on bone, I need a shoulder replacement, I need a knee replacement, hip replacement, and they don't end up getting it. Sometimes people do, against my good wishes, but I can't remember the last time that I have sent someone to have a surgery, okay? Be careful. If you want a free consult about this, call my office, talk to my staff. You can talk to them for free at 800-300-9300. You can also go to the website and watch videos of these simple procedures. You walk in, we take your blood, get the platelets out of it, or get your stem cells and inject it, and you walk out. You don't need anybody to drive you. You don't need anesthesia. It's simple. I've done so many of these. We are geared up all day long to do these. The website where you can watch this is www.jointrehab.com. You can watch the videos. And we also do this even not just on the musculoskeletal system for orthopedics, but on the face to grow back the collagen on the face. It's called the vampire facelift, or to regenerate the follicles on your head to thicken up your hair. So Barney, you got a hip problem. How long has that bothered you for?
Oh, it started yesterday or day before, and I could hardly get out of bed. I had to kind of force myself out, and it made tears come to my eye.
I'm sorry to hear that.
My left hip, and it feels like my nerve is being pulled through a little hole or something.
Okay.
A knot in the nerve or something. That's what it feels like to me.
Okay.
So,
can you tell me, if you're facing a mirror and you're looking in the mirror, what part of your body are you pressing? The front, the side, or the back, to show us where the pain would be?
The hip, left hip, just about belt height, and that's about the best I can describe it, I guess.
I know. Is it the front of your body, the side of your body, or the back?
The back.
The back. Okay, number one. The chances of that being your hip are close to zero.
Uh-huh.
People call that their hip, but that's the thing, most likely, what I talked about in the beginning of the show. I don't know if you were listening in the beginning, about most back pain comes from that area, and most of it is from a sprained ligament called the iliolumbar ligament. It's where it attaches from the L4-5 vertebrae spinous process down to the pelvis.
Uh-huh.
That's 99% of back pain that I see. And it can come on suddenly like that and hurt like the dickens, and it is so easy to fix. I wouldn't know what's going on.
Every time I cough or sneeze, oh my God.
Yeah, I know it. I've had it. 80% of people get it at some point.
Yeah.
The good news is it's self-resolved. That means if you leave it alone long enough, it hopefully will heal up, just like a sprained ankle. The reason that sprained ankles heal quickly and the back doesn't, in my opinion, and I'm making this up, so I'm telling you that, is the blood supply to the ankle is much higher than that to the low back. The ligaments are white tissue. There's no blood supply to them. And in the back, sometimes they don't ever heal. You can sprain a back and have it make you miserable for your whole life.
Oh, great.
Or it can go away in a minute. At any rate, write down this phone number. You ready? You got a pencil and paper? 800-300-9300. Call now, get a free consult with my staff, and get into the office. I'll get you in as quick as you want.
Okay.
Once I touch it, I can tell you exactly what it is.
Okay. All right.
But from what you're telling me, your leg is not weak, your leg is not dead, you're not having pain down your leg, and it's just that spot in the back where that ligament attaches, and there's no real difficulty to be concerned about. It doesn't feel good, but it's not a dangerous situation. You don't need to get to the emergency room. And if you had other symptoms,
I feel like I'm going to fall over.
Well, yeah, but if you had problems down the leg, then it may be something more important. You could have blown a disc or something like that. Are you able to go to the bathroom okay?
Well, I have to work at it to get there.
Is that normal for you, or is it different? Sorry?
I have to be real careful turning corners and stuff.
I know, but things are normal, right?
Well, I guess.
You have pain, but you're not having bowel or bladder problems.
No.
If you did, then I'd say go to the emergency room, because that could be what we call a cauda equina syndrome. But it doesn't sound from what you're telling me you have any of those kind of syndromes. And you don't have any tingling around the perineum, like if you're riding on a saddle. No. So you sound okay, and if you need to get a hold of me, you can get a hold of me easily. You can just look me up on the website, www.jointrehab.com. My cell phone number is when you call in. If nobody is there, my cell number is there. If you're ever in an emergency, you can get a hold of me, okay? And every one of my patients gets my cell number and my personal email address. I stay close with you guys.
Okay, well, that's good.
And gals.
Yeah, and gals. When I say guys, I'm gender fluid here.
Okay.
I understand that.
Yeah.
And can I say I bless you?
Yes, God bless you also, and I appreciate that.
Okay.
So Barney, stay in touch with me. Let me know how you do. And
okay.
You know, if I thought you need to come in, if this thing lasts for a little bit, I'm happy to see you and put my hands on the area and show you exactly what's going on.
Okay. All righty. Well, thank you. I'll give a call to the office.
All right. God bless, man.
Thank you for your call, Barney.
I'm going to give out the phone number. Then we're going to get to Carl.
Okay.
So the number here to talk to me live is 866-870-5752. It's Dr. Marc Darrow. And I've been doing the work of regenerative medicine using PRP, which is platelet-rich plasma, and stem cells. Back in the day, it was called prolotherapy, using, believe it or not, concentrated dextrose or sodium moreuate or zinc sulfate and other things that help stimulate tissue grow, create an inflammatory response. And it's a treatment that's very conservative, very easy to do. You walk in, you get injections, and you walk out. No one needs to drive you there. It's very simple. I use an ultrasound to guide the needle. And Dr. Grove is working with me, Dr. Thomas Grove. He was a linebacker for the Cornhuskers, a great athlete, a great guy, and very, very well trained. He's doing all the injections for me now. And I love the guy, and you'll love him too. So, Carl, you have arthritis in your back. How long have you known about back pain?
Basically, I went into my regular doctor for left kidney pain.
Okay.
And they did x-rays, as pro forma, and he said that I had severe arthritis there and some sort of misalignment or something.
Sure.
I work at a freight company, and, over the years, your back gives you some trouble. Anyway, he recommended going to an orthopedic surgeon. They gave me 10 names. And they gave me, cyclobenzaprine, 10 milligrams.
That's a muscle relaxant, yeah.
To take at night.
Yeah.
and 600 milligrams of ibuprofen during the day, not more than 4 times.
Okay. Well,
And
I don't like it. I don't like any of those medicines, to be honest with you. You can take them if you like them.
I personally, I don't like to take too much stuff. I think I'll just stay off of them if I can. But the pain is usually in the morning, and then I rub it. Just give it a knuckle rub.
Yep.
And usually I can get through the day without maybe a level 2 pain. In the morning, it's like a level 6.
Okay.
When I first get up.
Okay. So, I don't know if you were hearing the previous caller or callers earlier in the show, but most back pain is real simple to heal.
Right.
And arthritis doesn't stop you from getting rid of your back pain. Don't get alarmed when someone tells you have arthritis. As we age, there's 100 forms of arthritis.
Oh, I didn't know that.
Yeah, there's all kinds of them. There's inflammatory arthritis, there's rheumatoid arthritis, there's psoriatic arthritis, there's inflammatory bowel disease. The list could go on and on.
I should also, I'm sorry.
No,
I should
go
also
ahead.
say that I was hit by a car in 2020.
Okay.
And they had to put a plate in my my knee.
Yes. Tibial plateau.
Tibial fracture or something like that.
Okay.
Yeah. I would have thought that they would have caught this then, but I don't recall them talking to me about it.
Well, did you have back pain in 2020?
No, I didn't.
Okay,
this just started like, it felt like 2 months ago when I got...
Okay.
I've been to the gym, and there's a twisting machine that I use.
Sure.
I thought it was that, or I thought it was my friend gave me a wide belt, wider than I'm used to, and it kept pressure on that area.
Okay. So you've just given me something that is so important. This piece of information. You've had this. You had an accident in 2020. You're wondering why they didn't pick up the arthritis in your back. And the reason is because arthritis in the back doesn't necessarily cause back pain, and you weren't having back pain, but I guarantee you something, you had arthritis in your back then. Arthritis doesn't creep up overnight. Yeah. I'm sorry?
I would assume that I did have arthritis then.
Yeah, so don't anybody out there think because they find arthritis that that's the cause of your pain.
Right. I don't know. That's where I'm at right now, though. A consult I'm set to see the person in October. That's another thing. You're in pain, and anyway, I don't want to get into that. So.
Well, the medical system's fallen apart in this country. I'm sorry to say.
Yeah,
that.
I think so. The pricing is, and yeah.
And doctors, like my grandfather was a doctor. He got the phone call. Guess what he would do? He'd drive over to the person's house.
Oh, that's kind of unheard
now you
of
can't.
Now.
Well, not just that. You can't even get in to see your doctor.
Right. Well, my practitioner that I saw about the pain, I was able to see him in like 6 hours from my call.
That's good.
He's a pretty good guy. It's kind of a big place, and they got me in that day. It just had escalated. I'm back to my skinnier belt, and it seems to be helping some.
Well, that's good. So it wasn't your arthritis causing the problem. It was your fatter belt.
I think so. I kind of think so, but we'll know, I'll see what
Actually, I'm going to tell you what's going to happen.
Yeah.
Traditional medicine is going to look at your images and tell you what it says. And they're going to tell you that's the problem. And I promise you, in most cases, the images lie.
Okay.
So there are studies over and over and over. We take people that have zero pain and we do images. What do you think we find? Herniated discs, meniscal tears, rotator cuff tears, labral tears, herniated discs. We find all kinds of stuff, and the person says, I really don't care because I don't have any pain.
Right.
So get away from me. I don't need you.
Right. I prefer that because I know that if I go under the knife, it's going to cost me an arm and a leg or something. But I have good insurance. I'm still going to pay something, I'm sure.
That's one of the worst things I ever hear my patients tell me. I'm going to get insurance because I'm going to get a surgery because insurance pays for it. Oh, my God.
Well,
you know the costs after surgery? People lose their jobs. They have people that have to take care of them. There's all kinds of things that happen that are terrible. Medications they need, spinal cord stimulators. My God, I see this stuff over and over and over where people get sucked into surgery. I am sorry. This is not a statement against the surgeons. It's against their culture. I love surgeons. They do all the stuff that none of the other doctors want to do. It's just being overdone in the orthopedic field. Right.
What would they do if I did go see them? Oh yeah, you need a surgery. What would they do to me? Would you say?
Well, I don't think they would
cut
say
it out, or what do they do?
I don't know what they would say because I don't know what your X-ray shows. But you mentioned that one vertebrae is not on top of the other. That's called listhesis. Okay, spondylolisthesis. It doesn't cause pain.
Uh-huh.
You know, if it's like a grade 1 or a grade 2, not a big deal. Grade 3, maybe. Grade 4, that means that the vertebrae is not even on top of the other one. And that can cause problems in the spinal cord because the spinal cord gets stretched. But then you'd have problems down your arms or legs, depending if it's in the neck or back.
No, I don't have that. And it just happened after the gym and that twisting machine that you put your knees down and you twist the trunk.
Yep.
The trunk, and I do 12 reps or whatever on both sides. And it seemed to be that plus the belt did it.
Well, I don't think there's much wrong with you.
I didn't have. Go ahead.
Yeah, I don't think there's much wrong with you, Carl. And
okay, hopefully not.
I hope you don't go down the frickin' rabbit hole of traditional medicine. You know,
no,
I wouldn't be on those medicines. And if you take cyclobenzaprine, you got to be careful. That can make you dizzy, and it can get you in a car accident too.
Well, it says to only take it at bedtime.
Well, you know what? That's a great idea, but why take it at bedtime? You'll be asleep.
Well, true, and it actually puts you to sleep if you take it. I mean,
it's very sedating. I know.
I usually read a book by my bed and usually can read a chapter, but you take this stuff and I can't even read I read a couple pages and then I fall asleep.
Let me give you a little hint. That drug was taken off the market a while back because of addiction. Yeah, because of addiction.
Oh.
It's back on now. You know, drug companies have a pretty strong hold in politics.
Right.
They're in bed together.
Would you how would you treat arthritis in the back?
I don't think your arthritis is the problem, Carl. Do you get that?
Oh, okay. Okay.
I think you sprained your back.
Oh, okay. That could be. So you would recommend, I'll listen to the guy, maybe.
Listen to everybody. It's good to get everybody's opinion. And if they say you need surgery, that's up to you. I won't fault you for doing what you want to do. I wouldn't do it.
Okay.
And I would tell you not to do it. But I won't know anything unless you came in the office and I was able to touch the area. I could tell you in 1 second what's going on.
Right. Like right now I have no pain and I haven't taken any ibuprofen or anything. I'm just sitting here.
Stay off the medicines. You know that people die from ibuprofen?
Right.
It can burn out your kidneys.
600 milligrams, and I'm leery to take it. I take one capsule.
It can eat through the lining in the stomach. I've had a couple of people die in the intensive care unit from it. So I'm not a believer in medication unless you really have to have it.
Okay.
And that's not something you need to have.
I don't have any pain right now.
Well, also, you can take some pain. You don't need to medicate every time you have pain.
Right. No, that's true. That's true. Are there any treatments for arthritis? Is there some sort of
My God, you're harboring arthritis again when it probably isn't the problem.
Right. Yeah, I looked it up in my herb book, and arthritis can be treated by certain kinds of herbs and stuff like that, they say. But well, I'm leaning more towards your concept of stay off the medicines and it'll get better.
You can take herbs if you want. You know,
right.
You have to be careful, but sure, there's a lot of anti-inflammatory herbs.
And
that's
and some other
wonderful.
things.
That's wonderful stuff.
Yeah.
You have to be careful of one which is called white willow bark, because that's really aspirin. White willow bark, be careful of. That's really just aspirin in the natural form.
Willow bark.
Yeah, that's one that I don't recommend. But the other stuff, take all the...
yeah.
You know, another thing is you can go on an anti-inflammatory diet. Look that up. You can go on an alkaline diet. Look that up. That gets rid of pain.
How do you spell alkaline? A-L?
A-L-K-A-L-I-N-E.
Yeah.
It's the opposite of acid.
Okay. Yeah, I think I'd prefer to try that. I'll go ahead and go for a consult, see what I'm interested in. Are you going to be cutting into my back stuff? And I'll say no.
Well, I don't think anyone's going to want to cut your back based on what you have going on. But the thing is, when it gets more dicey, when you have things like herniated discs that show up, then doctors want to cut, and they don't need to. I mean, there are cases when you do need to. If you have a herniated disc that's 10 millimeters sitting on a nerve and your leg is dead, you may need an immediate surgery.
Right. What was your 800-300 number?
It's 800-300-9300. Call there, you'll get a free consult with my staff.
Okay, and that's your free consult. Okay.
Yeah.
Yeah, I don't know. Sounds like you don't do this. I'll listen to the doctor and then I'll probably not do it. That type of thing. Because
it sounds like I don't do what?
I don't get the surgery or anything.
Well, listen, I was trained in orthopedic surgery. I was going to be an orthopedic surgeon. And then I had, when I was a dummy back in med school, I had an orthopedic surgeon who was my boss operate on my shoulder.
Uh-huh.
I couldn't wait to get it fixed, and it blew up like a balloon, and I had a fever.
Ooh.
And I had 4 years of misery after that surgery until I learned about regenerative medicine. I injected my own shoulder, and overnight it healed. That's not the case with most people. I'm just going to tell you the truth. I was very fortunate. My wrist healed 50% overnight, my shoulder 100% overnight, and then guess what? I started begging my patients to try this.
Right.
And they were like, yeah, I don't want surgery, I'll try it. And then before I knew it, this is all I was doing. I've been doing this over 25 years now, all day long, every day of the week. I've been told I do the most of anybody on the planet. It's called regenerative medicine. Today we use platelets and stem cells to heal the body, to regenerate the tissue and rejuvenate it.
Okay.
We're going to send you a free book. My book is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Suzanne Summers, the famous actress, wrote the intro to it. And we got to run. God bless you, everybody. Get to the office at 800-300-9300. Look at the website, www.jointrehab.com. You can see videos of me doing these injections. God bless everybody. Thank you, Nita, Suzette, Alex, and the whole staff.
And remember to listen to Maura and Eckstein, our pal, 11 to 1 every Saturday, The Pet Show. See you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870, The Answer. Remember, to take the first step toward a pain-free life, call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.